Every 90 seconds, someone dies from a heart-related event. But did you know that heart attacks and cardiac arrest are not the same thing? In this video, I'm going to talk about the key features of it. I'm actually going to break it down into three main features, 1, 2, 3. And the most important thing is that number 3, if you notice, you'd be able to differentiate the two. And one of the reasons that I say this is because a lot of times you're hearing the news that so-and-so died from a heart attack when it was more than likely a cardiac arrest. Why is this important? Especially in the cardiology field, in the medical field, how we treat them are completely different. My name is Dr. Isang, and I use this platform to be able to discuss heart health and prevention. So let's go. When it comes to heart disease, when it comes to things like heart attack, heart failures, we know that heart disease is the leading cause of death in the United States of America. What can be more concerning is that if someone has a heart attack, 1 in 5 don't even know it. So let's just jump into it. Heart attacks versus cardiac arrest. Now, the first one is going to be plumbing. When it comes to a heart attack, it is a plumbing issue. So what does that mean? It means that it is due to a blockage in your heart arteries, also known as the coronary arteries. And how they typically present is crushing chest pain. Sometimes the pain exacerbates, radiates to the shoulders, to the jaw. It can be associated with some sweating, nausea, vomiting. We have to be very careful in these presentations, especially in the classical presentations, understanding that more of them were developed in males. So women can sometimes present differently. Also, diabetics can sometimes present differently instead of just having the classical chest pains, they can have shortness of breath, back pain, nausea, vomiting. There's been even some cases where someone developed their discomforts and thinking that they were having like a flu-like symptoms. So if there's a plumbing issue, if there's an issue with blockage, atherosclerosis, plaque buildup, the solution when it's occurring acutely is to fix it. Fix it acutely either with a stent, with a balloon. Sometimes if you have a lot of blockages, you may end up needing CABG, coronary artery bypass graft, done by the cardiothoracic surgeons. Now, that is comparing it to someone who's had a cardiac arrest. And the second thing is, how do you differentiate a cardiac arrest? What is it? Well, a cardiac arrest is more of an electrical issue. It is due to an abnormal heart rhythm, something like ventricular tachycardia or ventricular fibrillation. Other dangerous ones, things like WPW, can also be it. When someone has a cardiac arrest, the most important thing is to start CPR and shock them out of that life-threatening rhythm. Then, after you've gotten the pulse, you've gotten them back, we need to figure out what could have potentially caused this. You have things like issues with electrolytes, you have genetics, congenital issues, things like hypertrophy, specifically hypertrophic obstructive cardiomyopathy. This is when we see those young individuals who are playing sports, basketball, football, baseball, soccer, and they just drop dead in the middle of the field. And once you've gotten them back, early recognition, starting CPR, defibrillation, then we have to go and do the workups. And the workups is pretty extensive. It can include things like doing a cardiac catheterization, but checking an echo to look at the squeeze function, checking a cardiac MRI to look for any potential things that could have led to it, things like sarcoidosis, etc. But this is in comparison to someone who's having a cardiac arrest. They don't just drop dead unless they've had such decreased blood flow in that heart artery area that they start to develop abnormal heart rhythms. So to sum it up, when someone is having a heart attack, it is a plumbing issue due to plaque buildup. You fix it by opening up that stent, you're opening up that blocked artery with a stent, sometimes with bypass surgery. In comparison to a cardiac arrest, which is an electrical problem, things like ventricular tachycardia, ventricular fibrillation, treated initially by starting CPR because they don't have a pulse, a perfusible pulse, that heart is just fibrillating or beating so fast that it's not getting enough blood flow. Chest compressions, early defibrillation, and then figuring out why. Was it congenital? Was it electrolytes? Was it toxins? Was it due to ischemia itself? Once again, if someone has a heart attack or someone has a blockage, it can lead to that area not getting enough blood flow, which can then turn into heart rhythms. So the third one, basically already talked about it by summing it up, is the presentation. When someone is presenting with a cardiac arrest, they are presenting basically dead. They dropped down to the floor. They're not getting any blood flow to the heart, to the important organs, to the brain. You treat it by doing CPR and then getting the Zolpad or getting some type of way to figure out what your rhythm is, and then you shock them out of that life-threatening rhythm, sending them to the hospital to figure out what potentially could have caused it. Was it a congenital disorder? Was it issues with electrolytes? Was it issues with ischemia? We do things like echocardiograms, heart catheterizations, cardiac MRIs, urine toxins, drug screens, getting a bunch of labs just to make sure that we're not missing what potentially could have caused it. And if we can't find a true cause for it, or if the cause is something that cannot be treated appropriately, then these individuals are going to need a ICD, a defibrillator, an internal defibrillator, that if God forbid they should ever have this life-threatening rhythm again, that they will be defibrillated to get them out of that rhythm. Comparing it to a cardiac arrest, which is due to blockage, understanding what the risk factors for those blockages are, things like high cholesterol, diabetes, a strong family history, smoking, genetics can cause it, and over time can lead to more and more blockage until a heart attack happens. You treat it initially by putting in a stent or sometimes doing coronary artery bypass graft or CABG, but also looking at those risk factors and getting it treated. Hypertension, high cholesterol, diabetes, to prevent further issues from happening in the future. I do find that my patients who have repeated episodes have one or two things. Either they're still smoking, have really bad, or I guess one or three things, have really bad genetics, or have really poorly controlled cholesterol. Cholesterol is not the only thing, but it is one of the biggest risk factors for heart disease and heart attacks. I hope you guys got a good overview, understanding 3 things that are associated that can help differentiate cardiac arrest and heart attacks. And if you got any questions, leave it in the comments. If you were looking for more videos, I'm going to be talking more about heart attacks and chest pain in this video. Dr. Isang.